I've been in the healthcare industry for 22 years. I've led Medicare Advantage plans, Medicare ACOs, all of the tracks, and then IPAs, MSOs, and most recently a large primary care group that is in 19 states. I became aware of Lightbeam prior to Lightbeam starting, so I did get to see it grow and start and what it's done for the industry when it comes to data aggregation and what also you can do to make actionable data for the patient both inside and outside of the exam room. We live in an industry or a healthcare industry that is challenged in access to care, care delivery models, as well as making sure that patients' outcomes are positive. And I'm very passionate when it comes to the senior population and how we can remove unnecessary care, make care available timely. Our patients need to be able to have the right care at the right time at the right place. And without that, we're going to continue to live in a very fragmented healthcare environment. We have to deal with social equity, and we just need to make sure that we're proactive in care versus reactive because we don't have enough resources to continually react to patient care. We have to start getting ahead of it. My goals at Lightbeam are to help grow current programs, really expand what we do with the different patient populations, how we engage with not only the provider community and the physician community, and when we think about health plans and we think about hospital systems, but really how we engage with the administrative staff and the other clinical staff. Because in order to truly impact a patient, it takes everybody that touches that patient, whether it's a physician in the exam room or a nurse, and then it's the individual that's either using technology through AI or it's an individual that's on the phone. So I've been fortunate enough over the years to see a lot of different programs, well before any data aggregator or clinical programs really existed. We used a lot of spreadsheets, we took raw data, and we tried to figure out what we need to do to impact care. When I think about what Lightbeam has developed compared to the industry, they've developed the ability to show providers how the cost of healthcare occurs, how clinical outcomes happen, and also they're taking the ability to reach a much larger patient population out of the exam room. And by removing it, the breadth of engagement to that patient population impacts a larger group in outcomes. That was unique in the industry. They started by thinking about long term, and now when I look at all the suite of what Lightbeam offers in the industry, it's best in class.